Hello, and welcome to the 2025 Advocacy Video Series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern. I'm going to UNR getting my MSW. This series is intended to bring light on the impacts of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we continue to serve those in need and inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Tom McCoy from the Nevada Chronic Care Collaborative. He is also one of the board members here at the Nevada Minority Health Equity Coalition. Tom, could you introduce yourself, tell us your story, what you do, and why you got into this work?
Well, that's a long story. First, let me just set out what the collaborative is, what NCCC is all about. It's a network of health organizations that advocate public policy that improves the lives of Nevadans with chronic diseases or conditions. And the reason that is important, and that kind of explains our target folks that we serve. Over 60% of adult Nevadans have at least one chronic disease, and almost 50% have two or more. So that's a lot of Nevadans involved. And so what we do is we bring together as a collaborative other organizations that share a particular public policy change that's needed. I'll give you an example. Last session, we addressed the problem of pharmacy benefit managers. I won't go into great detail, but it does impact access, and that's what we're all about, access to care. It impacts access and cost. And we were able to pull together various organizations as a collaborative, as a coalition. And we were able to get the legislation passed out of both houses with only two negatives, only two no votes. But some last minute maneuvering and changes, we didn't get the deadline, so the bill didn't pass. And so we'll be back again in 2027. But that's the kind of work that we do, is we join with others in trying to move a piece of legislation to the goal line. And what the goal line is, how it's determined, in some ways is kind of how you set out at the beginning. What challenges are out there in the canvas, if you will, that is healthcare, that is public health. And there's a lot of changes, and that's going to mean a lot of approaches may have to be looked at totally differently as we move forward in legislation in Nevada.
So, could you tell me your story, why you got into this field?
Oh my gosh. To be honest with you, I was to the point of saying, yeah, maybe I'll just retire. And in 2008, um, I had an opportunity to join the American Cancer Society and do advocacy work. Now, I had done advocacy work in the corporate field in Washington, D.C., but never for a nonprofit. And I thought, oh, this should be easy. Well, it's totally different, and it's much more rewarding. And so I became the Nevada Director of Government Relations for the American Cancer Society Cancer Action Network, and I did that for 12 years. So in 2020, there were a lot of changes in the nonprofit world due to COVID, and I made a switch to the Nevada Chronic Care Collaborative. And so why do I do this? I think it's the fact that I know I'm helping people.
Thank you for sharing that. I can see how much the work that you do means to you.
Well, you know, I think any of us can look back and say, Uncle Frank had such and such, and my grandmother had such and such, and maybe I can make a difference for other people's grandmothers and other people's Uncle Frank. And there's a lot of truth to that because you don't really get that rich doing advocacy work. But like I said earlier, there's quite a bit of reward just knowing that you made a difference. Uh, the very first activity that I got involved in advocacy in Nevada was it was a struggle because I just assumed everybody would put their arms around this particular piece of legislation. What we were trying to do was establish a cancer drug donation program in the state. And I had some pharmaceutical companies that were concerned about drugs that might be turned in that wouldn't be still efficient and be usable. I had some trial lawyers that were, it was an amazing opposition. So I had to negotiate with these folks and get it worked out. But ultimately, we established a cancer drug donation program. And the reason I bring that up, and you say, tell your story, this is one of those stories that I always think about when I have a challenge at the legislature and gee, do I want to go see five more legislators and try to tell them to pass this bill? I got a call after the cancer drug donation program was put into place. And it wasn't just a matter of passing legislation. We had to get the regulations and work with the Board of Pharmacy. And I got a call from a pharmacist in Las Vegas who said, I just want you to know that you saved somebody's life. That makes you stop and think. But what had happened is this lady did not have access to her particular medication. She didn't have insurance. She didn't have the ability to pay. And somebody had turned in this medication to this particular pharmacist, and he made it available to her. And it kept her alive for a period of time until something happened. She was able to get access to the medicine otherwise or whatever. But that's the kind of feedback that makes you say, this is all worthwhile.
That's incredible. So I wanted to ask you, has there been any particular challenges that you've successfully navigated in the past that might inspire others to keep on keeping on?
Oh, yeah, I can tell you about one in 2007, and I wasn't involved in this particular piece of legislation was talked about and thought about. I came on board, and so 2009, we introduced legislation 2011, 2013. We were trying to get passed a bill that would prohibit anyone under 18 to use a commercial tanning bed. Tanning beds lead to skin cancer, melanoma. We had a significant increase in younger people coming down with melanoma and skin cancer. So we were trying to get legislation. All right. So you're told no, you're told no, you're told no. We kept on, and in 2013, we passed the only the fourth state in the country to do it. So Nevada became quite a benchmark, if you will. Everybody said you can't pass something like that in Nevada with all the show people and people wanting to look their best, and we were able to achieve it. So my suggestion is don't give up.
Yeah. That was going to be my next question is if you have any tips for
Well,
anyone else working in this
that
area.
that's a tip, and probably the best tip I can give if we're talking about state advocacy, and it would apply to federal as well, is get to know your legislator, your legislator. You know, I try to impress upon advocates that volunteer to work with us on legislation that they need to contact their senator, their assembly person, and they turn to me and they say, "Who is it?" And that should be the starting point for any of us, whether we're advocates or not. We have a citizen legislature in Nevada. They're part-time. They don't make a lot of money. Some states, it's a full-time profession. It's not in Nevada. And so these individuals rely on us for input, and that's extremely important. You can bring up an idea of legislation that you feel would be beneficial to you, to your family, to people in general, and they'll listen. And sometimes that's how legislation starts, is somebody calls up the legislator and says, "Hey, I got this problem. Can you help?" So know your legislator. That's a good place to start any conversation dealing with legislation.
That is wonderful advice. I will have to figure out who my legislator is.
I was gonna ask you, Alicia, who is, and it's available. It's available on the legislative website. You can enter in there who's my legislator, and you put in an address, and it pops up and tells you who it is. Now, I should point out that some people may not be aware that watch this particular uh, series because they're new to Nevada. We're a biennial legislature, so we only meet every 2 years. So we don't meet again until 2027, which means in 2026, we're going to have an election. And the typical churn is about 30% of our legislature changes. We already know some key legislators in the assembly are not going to run again. These are leadership people. That makes a big difference. And so you need to know that perhaps the legislator that's identified with you right now, Alicia, may not run again in 2026 or may lose in 2026. So take a look after November 2026.
Okay. All right. Well, I wanted to thank you for taking the time to speak with me today. And for those of you tuning in, thank you so much for listening to Tom's story and do your best to be advocates yourselves. And then also check out the other videos in this series. Thank you.
Thank you.